Hi, everybody. I'm Dr. Prabakar, and welcome to my series this August on fibroids and fertility. So, today I'm going to be talking about this topic. Should I remove my fibroids prior to trying to get pregnant? If you're here and this topic is of interest to you, clearly make sure you see the previous video, which was Are my fibroids preventing me from getting pregnant? So, make sure you watch that and then come here and obviously listen to this where I'm going to be discussing kind of timing of fibroid removal. This is a topic that so many women are super stressed out about because they find out that they have fibroids maybe while they're trying to get pregnant. Maybe they haven't gotten pregnant for a while and they're now getting a workup, getting an ultrasound, or perhaps they're already doing IVF and now they're told, hey, you've got fibroids. And so the concern and top of mind for many patients is, should I remove these fibroids and then try to get pregnant? Should I get pregnant? And then if it doesn't work out, remove these fibroids. So I want to guide you through that process of how you think about it, okay? I'm Dr. Prabakar. I'm a board certified OB-GYN, minimally invasive surgeon. I practice in Northern California where I take care of many women with fibroids who are also trying to get pregnant, and we are trying to do the best for them so that they can go on to have, the family of their dreams. So let's dive in. So on this topic, I want to share a patient story with you guys. This is a patient I'll never forget. When I first started my practice here, I saw this patient who had a fibroid. It was pretty small. It was like 2.5 or 3 centimeters, and it was in a place that was not necessarily going to impact her fertility. So it was not, and by that I mean it was not in the cavity. So it was not a situation where we would have said to her, hey, you really have to remove this fibroid prior to getting pregnant. So she went on to do IVF because of other factors. She was older. She, had already tried conceiving by herself. That was not working out. She had already proceeded to IVF. Otherwise, she was really healthy. And she had miscarriage upon miscarriage with really perfect embryos. So her IVF doctors told her, well, I don't think it's the fibroid because it's so tiny, first of all. And second of all, it's not in the cavity. So she came to me and I sort of said the same thing. I was like, I don't think this is really causing, your miscarriages because it's not quite, in the cavity. But you've had like 3 miscarriages now with really normal embryos. I'm happy to remove it. Now, to remove it, this was a robotic surgery. And so this was not like an easy decision to be like, sure, like, I'll remove it. It is kind of a big decision to undergo surgery and then have to wait, a certain amount of time prior to her next IVF transfer. But we figured this was the best thing to do because, again, she'd already tried several times and it was not working out. So we did a robotic myomectomy, took out the fibroid. Lo and behold, she got pregnant the next time and went on to deliver a healthy baby. So what is the moral of the story? I mean, people don't always follow the textbook, and sometimes you just have to put the whole picture together when trying to determine whether you should remove these fibroids prior to conception. So just wanted to share that with you guys because it's always a reminder for me when I counsel patients, and we'll get into the details that you have to think about. Okay. So number one, how many fibroids do you have? Okay. Do you have 1? Do you have 5? Do you have 30? Right. This is something you want to think about when you are considering, should you remove it before or, just kind of wait and see what happens. Because if you've got 1 fibroid that's 5 centimeters and it's in the wall of the uterus or kind of on the outside, subserosal, maybe you're not too, maybe it's not a big deal. But if you've got 30 fibroids, which yes, we've taken out more than 30 fibroids before, this may be a bigger deal because it's impacting your entire uterus. These fibroids may grow during pregnancy. It's going to be hard to predict which fibroids are going to grow, which are not. And overall, it's just going to be an unfavorable kind of environment for this baby to grow in. So you want to think about, how many fibroids you have. And then secondly, is it distorting the cavity? this is a very, very important question to ask. I have fibroids, but is it really pushing on the uterine cavity? Is it kind of bending the cavity? Is it making the cavity, not nice and perfect? Because again, this is where a baby forms, so you do want that cavity to be as nice and close to perfect as possible. You don't want it to be bent with all these fibroids. So that's the other question. You really want to know, is it distorting your cavity? And an ultrasound doesn't always show this. You can do a saline ultrasound where we put some water and then look at the cavity, or you could do an MRI. So these are better imaging modalities to really help us determine whether it's impacting the cavity. And if it's impacting the cavity, yes, I would recommend that you actually remove this prior to conception. Will you be lucky and you'll still get pregnant and all will be well? I mean, sure, but you're kind of gambling there. Okay. Um, Third, you want to consider your age and your ovarian reserve. Okay. And this is so important because are you 20 and you have fibroids and you're like, well, let me just try to get pregnant and see if it works out. You've got a lot of time ahead of you. You've got, otherwise you're healthy, you've got plenty of eggs. Or are you in a situation where you're 40 or 45 and you're kind of on your last embryo, for example, or your last like hurrah to try and get pregnant? Well, then, your mindset may be a little bit different. You may be like, okay, I got to do everything I can to optimize my chances of getting pregnant. So if that's you, then yes, you do want to remove your fibroids ahead of time because maybe they're impacting the cavity, maybe there are many of them, or maybe there's this unknown factor where they just secrete kind of inflammatory chemicals that make the environment of the uterus unfavorable for an embryo to implant and actually grow and continue on to become a successful healthy pregnancy. So you want to take a look at that. Where are you in the whole spectrum? How old are you? What are your other medical conditions? Do you have, what is your ovarian reserve, either naturally, or maybe you've got 30 eggs preserved, or maybe you've got 10 embryos and you're willing to gamble a little bit and see what happens, versus somebody who really has done a lot and now they're kind of at the tail end of what they're going to be able to put forth in terms of getting pregnant. Okay. Number 4, you want to consider your surgical options when you're thinking about removal of fibroids, especially prior to pregnancy. You want the least amount of scarring. You want the most minimally invasive techniques. So if you've got a fibroid that's just in the cavity, often we do a hysteroscopic myomectomy, which is going in right through the cervix, through the vagina, cervix, uterus, and removing the fibroid that way. This is a very quick and easy procedure overall. Your turnaround is quick. So you go home the same day. Your recovery is, very short, and you're able to kind of move on with trying to get pregnant in just a few weeks. Or are you a candidate for robotic surgery? Maybe you've got larger fibroids. Maybe they're not in the cavity. They're kind of on the outside. And we need to tackle those, from a different approach. This is a great option. Again, most patients go home the same day, but the recovery is a little bit longer, more like 2 to 6 weeks prior to, fully getting back to normal activities. And we usually recommend waiting 6 months, prior to actually conceiving. Or are you a candidate for open surgery, right? So maybe you've got huge fibroids, 20 centimeters. I mean, I once took out a fibroid that was 25 centimeters, and another patient whose fibroids were 7 pounds. Okay, this was the biggest one that I've taken out, but 7 pounds. So that required an open approach, which means, making an incision, either like a C-section incision or kind of an up and down incision to open up the belly and like literally take this big fibroid out. So there are other situations like that where you may need to have a laparotomy or an open surgery. So you want to start thinking about, well, where do I fit in? What does that look like? What about recovery? and really start planning this out with your surgeon. This is a time to get second opinions and really try to hone in, like, who are you going to have operate on you, and what are the expectations, what's the recovery, how soon can you get pregnant after. So these are the questions you want to start to think about. If you are somebody with fibroids and you're trying to decide, okay, should I get them out before I try to conceive or after? These are all surgical options that you want to consider and start talking to a couple of different surgeons about, so you can really feel confident with, whoever you choose. And number 5, you want to think about the timeline and the recovery period. When we think about trying to conceive, one of the guidelines that upset some patients is that you really have to wait 6 months after removing a fibroid in order to get pregnant. This is a robotic or an open approach, okay? The hysteroscopic approach, usually, as I mentioned before, 6 weeks, 4 to 6 weeks, you can continue, you can try again. But the robotic or the open ones, we've done it that way because the fibroids have been extremely large, and we really need that uterine muscle to heal. And there's no good data on this, but the kind of current understanding is 6 months. Now, why is this? Because we want that muscle, the uterus is a muscle, and we want it to remodel and kind of be nice looking again, strong, to withhold a pregnancy. We don't want to make all these cuts on the uterus and then bam, have it start expanding again with a pregnancy, because that's going to make the uterus weak. It's going to make the muscle weak, and it increases the risk of uterine rupture during pregnancy and during labor. And so we want to minimize this. We want to give the uterus its appropriate time to really heal and then move on with pregnancy. Okay. And when we think about recovery and timeline, something that I want you guys to also think about is, if you're attempting IVF, and it's clear that you've got to remove these fibroids before trying to get pregnant, first remove them. And then while you wait and do the recovery period, this may be a good time to do another IVF cycle. This may be a good time to harvest some more eggs and, make embryos. So you're not just like wasting those 6 months sitting around with recovery, but you're also actively doing something else versus, making your embryos first and then doing your surgery. We've done it either way, but for those who are really time conscious and they don't want to waste any time, they already know they have to wait 6 months. They want to get the surgery done first and then do their embryo retrieval and egg retrieval, sorry. So these are some of the things that I want you guys to think about when, if you have fibroids and you're trying to decide, do I take them out now before I get pregnant? So number 1, how many fibroids do you have? Number 2, is it distorting the cavity? This is a very important question. Number 3, how old are you and what is your ovarian reserve, in general? Number 4, start considering your surgical options, hysteroscopic versus robotic versus open. And number 5, think about the timeline and recovery, because this is also important in planning, when it is you want to try to conceive compared to when you want to remove your fibroids. So hopefully this has given you guys some more clarity as to, how to start thinking about this. If you have fibroids and you think you may need surgery, when do I do it? Do I do it before? It's something to really sit with, get a couple of opinions before you make your final, decision. And don't be afraid to get, 2 or 3 opinions from different surgeons and doctors, maybe an IVF doctor or gynecologist, so you can kind of make the best informed decision possible. Okay. And if you're in the Bay Area, come and see us. We are in Northern California, and we can see actually patients anywhere in California, Dr. Christensen and myself. Or if you're somewhere else in the country or the world and you just want some coaching around fibroids, we can't quite be your doctor, but we can definitely talk you through some, options and just give you more information. If you just want some more information that's tailored to your specific, situation, feel free to contact our office and set up a fibroid coaching call. We'll be happy to go over that with you. All right, guys. Hopefully this was very useful for you. Please share tag a friend who can use it. A lot of doctor's appointments are just 10-15 minutes long. It's rushed. Patients don't feel like they can ask questions and get all the answers they need. So I would really appreciate you sharing this if you found this useful. And then don't miss my next episode, which is how do fibroids affect my pregnancy, once I'm actually pregnant. So if you are already pregnant and then you suddenly find out, oh my goodness, I actually have fibroids. I did not know that I had fibroids before. What does this mean? How does this play out in pregnancy? That's what we're going to talk about in our next video. So hang out and watch my next video to learn more about that. Okay, until then, bye.